Ladies and gentlemen, without further ado, let's listen to your keynote speaker, Mr. Ide Owodiong.
Thank you very much. Thank you very much. Akwa Ibom song, His Excellency, here represented by the SSG, members of the State Executive Council, the National President of Akisanusa, Chairman of Board, Council members and Board members, my dear friend Akadimo Dofia, and everyone on the high table, and the great members of Akisan. It's indeed a great pleasure for me to be here to give this keynote speech at the 2021 National Convention of the Akwa Ibom State Association of Nigeria, USA Incorporated. I had this rare privilege in 2013 when I delivered the keynote speech at the convention held in Washington. The topic of my speech at that convention was raising the Akwa Ibom child within the American sociocultural environment. This year, I will be speaking on the topic, youth development and empowerment in the post-COVID-19 era, response, recovery, and resilience. This is in line with the theme of this year's convention, celebrating our youth and the resilience of Akwa Ibomites in the COVID-19 era. According to a World Bank report issued in April 2020, post the outbreak of the pandemic, COVID-19 will lead to an increase in poverty of about 40 to 60 million people, with a best estimate of about 49 million moving into extreme poverty. The pandemic is also projected to be the likely cause in the increase in global poverty since 1998. Although sub-Saharan Africa, from a health perspective, has been impacted relatively less by the virus, World Bank projections suggest that it will be the region hit hardest in terms of increased extreme poverty. At the country level, the three countries with the largest change in the number of poor, according to the World Bank estimates, are to be India, 12 million, Nigeria, 5 million, and the Democratic Republic of Congo, 2 million. What is certain is that as of last week, Nigeria had confirmed 171,728 cases of COVID, of which 2,134 cases have resulted in death. For Akwa Ibom State, the number of confirmed cases has been 2,090, with 20 deaths in total. When you compare this against the data being tracked for the world, at 196 million confirmed cases and about 4.2 million deaths, we may fall under the false assumption that Nigeria's management of the pandemic is much better than other countries. But this would be a deadly mistake, because we do know that the greatest problems underpinning the seemingly low number of cases in Nigeria are limited testing and myths that Africans are immune to the virus due to years of exposure to malaria treatment and our tropical climate. Whatever that may be, it is important to note that the actual death toll from COVID-19 is likely to be higher than the number of confirmed cases, confirmed deaths that the NCDC or the Ministry of Health are able to track and the Nigerian Bureau of Statistics able to report. What is certain is also the fact that the effect of the pandemic has been ravaging. In fact, COVID-19 has been the singular most disruptive pandemic witnessed across the world in recent times. To say that we are living in an unprecedented time because of the COVID-19 pandemic will be an understatement. The pandemic has brought with it a myriad of complex challenges that impacts a wide range of systems affecting normal living, whether it's in public health, economic, social, technical, time, emotional, environmental, and many other aspects of our life. All these systems are interconnected, and which in turn creates even more variables as these open systems reshape constraints and possibilities. But beyond these are the real issues of psychological distress arising from confinement-related challenges, sudden death of loved ones, minimal social engagement with family and friends, etc. These never-before-seen dynamic requires us to use a systemic approach and undertake complex decisions to address the recovery and resilience issues post-COVID-19. Nigeria has the largest population in Africa, largest youth population in Africa, and since the COVID-19 pandemic erupted, Nigerian youth population has been the most negatively impacted, more than any other demographic, largely due to the disruptions of essential health, nutrition, and social services. Young people under the age of 25 account for over 60% of Nigeria's population, and of this demographic, 16 million were out of school in 2019, or from the last count of 13.2 million in 2018. The same can be said of our state within Nigeria, its youth population bursting out of its seam. The economic impact of the pandemic has been observed to be particularly harsh on the youth and micro and small businesses. To worsen the situation, the growing number of uneducated youths poses a significant burden on the economy, as this demographic struggle amidst a back-to-back national recession and severe downturn caused by the pandemic, which has impacted most of the approximately 40 million SMEs in the country, where young people find employment. In summary, Nigeria is in a precarious position with the youth unemployment crisis hanging like an albatross over her neck. She can do without the effects of COVID-19 being added to her woes. Now, the eruption of pent-up forces during the #EndSARS protests, which rocked the foundations of the country, is a glaring testimony of the potency of youth disenchantment over the debilitating state of the nation. Nigerian youth defied the COVID-19 mitigation rules to protest increasing police brutality and failure of government. The resulting killings of protesters at the Lekki toll gate by the military, which triggered massive, widespread protests across the country in a magnitude like never before, brought to focus the stark power of Nigerian youths, who make up more than 65% of the nation's population, a force waiting and begging to be mobilized for the betterment of Nigerian society. I will skip the aspects of government response. We all know what the government did, how the government responded to COVID-19, but more importantly, I'd probably like to focus on what Akwa Ibom as a state did. The response situation in Akwa Ibom State was not different from what the federal government did. The state keyed into the actions that were being taken by the federal government to contain the spread of the virus, but in fact took additional steps to combat the COVID-19 onslaught. So this took various forms and include, the activation of the infectious diseases hospital in Ide, public lockdown to check spread of the virus, the activation of the emergency operations center, the activation of additional isolation centers at the Ibom Specialist Hospital to support the IDH in Ide, setting up of 2 molecular testing laboratories at Ibom Specialist Hospital and the Methodist General Hospital at Itungbang, provision of palliatives to cushion the effects of lockdown, training of personnel for COVID-19, procurement of ventilators and mobile ambulance vehicles to enhance conveyance of patients in emergency situations, and of course the building of the 300-bed space isolation center at the Methodist General Hospital at Itungbang to further expand the isolation capacity for patients, and the building and construction of medical gas plants at Itungbang to maximize oxygen requirements of patients in care. I think this is something that we all need to commend the state government for taking these very proactive and significant steps to respond to COVID-19. Unfortunately, despite all the efforts by government, the federal government of Nigeria just this week declared Akwa Ibom hotspot for the Delta variant of COVID-19. Disclosing the status, the Director General of the NCDC stated during the national briefing on August 2 that 80% of the tests conducted in Akwa Ibom State have been confirmed to be Delta variant of the deadly virus. This variant, which is more insidious and deadly than the previous strain, is generating a scare within the state. But I'm happy with the steps being taken by the administration of Governor Odom Emmanuel with the ordering of 1 million doses of COVID-19 vaccines to combat the Delta variant spread in the state. However, these efforts, especially testing, needs more private sector involvement to significantly ramp up COVID-19 diagnostic centers across the state. Sensitizing and mobilizing citizens to take responsibility by strict implementation of preventive non-pharmaceutical measures is key to flattening the curve. A rapid, holistic, cohesive whole of government approach that encompasses civil society and local communities will be absolutely critical to combating COVID-19 pandemic. What has been the impact of COVID-19 on youth development and empowerment? The impact on young people, especially for vulnerable youths across the world, has largely been felt in the fields of education, employment, mental health, and disposable income. The worrying challenge is that if governments are unable to effectively execute recovery measures, present and future generation of youth may have to shoulder much of the long-term economic and social consequences of the crisis. Their well-being may be superseded by short-term economic and equity considerations. It is therefore imperative that governments need to anticipate the impact of mitigation and recovery measures in order to avoid exacerbating intergenerational inequalities and rather involve young people in building societal resilience. What is the way forward? What do we require to get us back on track as we work our recovery post the pandemic? Yes, the impact of COVID-19 has been largely negative and disastrous, but in it also lies huge opportunities for transforming how we think about our economies and our societies. As countries emerge from the shadows of the COVID-19 crisis, governments are focusing on how to rebuild labor markets to allow them to be more resilient, more inclusive, and more productive, as well as build a path towards a greener and more digital society that empowers everyone to face the future with confidence. Indeed, I must commend yet again the very proactive and pragmatic steps taken by the Akwa Ibom State government in the heat of the 2020 lockdown to get itself ready for recovery and build societal relevance, societal resilience for the future. This was demonstrated by setting of the post-COVID-19 Economic Reconstruction Committee. The committee did put out calls to the public to send in their ideas and contributions towards developing positive recommendations for delivering a stronger, more social and economically viable Akwa Ibom State post-COVID-19. A not-for-profit organization which I lead, known as 1001 Plus Voice Initiative for People's Empowerment, responded to this call and sent a memorandum to the committee. I would like to spend just a few minutes sharing with this audience the recommendations in that memorandum. The key, of course, was that the state should be looking at adopting a three-pronged strategy. One, employment creation, revenue generation, and asset maximization. It is our view that if we continue to invest in creating employment for our youths in the areas of information technology, in the areas of agriculture, to mop up the large number of youths that are unemployed, continue to invest in industrialization and business development, and also the creative industry. The creative industry is the second largest film industry in the world, contributing about $7.2 billion to Nigeria's GDP in 2018, representing about 1.42%. Separately, the music industry generates similar revenue and contributes to the Nigerian economy. These industries, along with fashion, fine art, culture, and tourism, are uniquely attractive to youth and harness their energy, versatility to leverage untapped talents. The youth of Akwa Ibom State are no exception in this regard, and does provide the state with a vehicle for economic and social transformation. In terms of its value, we think that this can really be valuable in building the right development and empowerment of our youth and residents. We also would like to see more investments in ensuring that we can have some independence in how we generate power to support the businesses in our communities, in our state. And of course, look at areas where we can deploy digital governance across board. There's more to it. Conclusion. In all the foregoing, the youth aged 15 to 35 will be the target beneficiaries. As previously stated, this demographic constitutes about 60 to 70% of the population, approximately 1.8 to 2 million of Akwa Ibom population. Developing and empowering them will require providing them with early access to key skills and tools to leverage and maximize knowledge transfer, commercial opportunity, and value added. They will reshape and redefine the knowledge base, tax base, and value system for the state going forward. The group will act as the early adopters to those in other areas, for example, rural areas, as to the initiatives and their benefits from adoption and use. For those living in the urban areas of centers of Akwa Ibom State, both skilled and unskilled, the expectation is that they will have closer access and exposure to those initiatives that are situated in the towns. This category of youths will principally be the first to receive the benefits and can be engaged to be the change ambassadors to those in other areas, for example, rural areas, as to the initiatives and their benefits for adoption and use. Finally, for those living in the rural areas, villages, and agricultural communities, skilled and unskilled, they will most likely get the largest share of new jobs, skills transferred, and value derived. Youths in the rural areas will be the primary beneficiaries of implementation of the agriculture and power deployment sections of the proposal to develop and empower our youth in the post-COVID-19 era. I hope I've been able to lay out in very broad strokes the policy direction that the current government in Akwa Ibom State should continue to deepen, and the government that will succeed it in 2023 should follow in developing and empowering Akwa Ibom youth in the post-COVID-19 era as a deliberate strategy of recovery and resilience for a secured future. This is clearly a once-in-a-lifetime opportunity to rethink and rebuild our economy for growth. A recovery and resilience strategy that is devoid of curbing increasing level of youth unemployment and the implications of rising debt for issues of intergenerational justice, as well as threats to the well-being of youth and future generations, is not a sustainable one, and its implications are huge. Thank you for listening.
Please, come on now, you can clap better than that, if nothing else. Tomorrow is Sunday. Clap like today is Sunday, please. Atlanta people, Akwa Ibom is sound. Come on now, Ide Owodiong-Idemeko.